Alright, so in this video we're going to do wound care and hand washing. So you got to order for wound care on your patients. So you always got to check you have the right patient, you're in the right room, look at the orders. Each wound care is different. You know, depends on if it's done, if the order is put in by the surgeon, wound care team, or the primary care provider. You just got to go off based on that order. So same as always, you go in, you introduce yourself, tell the patient, hey, we're about to do wound care. If it's a big wound, deep wound, I always give them a pain pill, you know, usually a nursing judgment based on their vitals and blood pressure and all that good stuff. But they agreed to wound care. I said, okay, so before I do all that, let me go ahead and let me go ahead and wash my hands before I look at the wound. So when you wash your hands, let's say, you know, here's the faucet. You can go ahead and remove all your jewelry, watches. If you have long sleeves, go ahead and move that up. From there, you just go ahead and look at your skin, make sure you got nothing soiled, any type of break in the skin, any, you know, just look at your nails, just anything that, you know, look for cuts, anything that's soiled. All right, so from there, go ahead and turn to warm water. So you got the warm water flowing. You're going to pretty much keep like a straight forearms, or make sure you keep the elbows straight. So you're going to just run your forearms through the water. Okay. And then from there, you're going to get about a teaspoon of soap, and then you're going to clean everything. Throw forearms, hands, fingernails. You're going to do this about 15 seconds. So you do that about 15 seconds, you know, and after that, you'll rinse your forearm, your hands through the warm water. Same thing, try to keep your elbows straight and just go in and out through the water. And then from there, you can grab some paper towels. So grab paper towels, you're gonna dry yourself off from the fingernails towards the forearm. So you're gonna pat it, throw that away, pat it, throw that away, and do the same thing for the other arm. From fingernails to forearm, you're gonna continue patting it. And so you're gonna be cleaning when you wash your hands, you're gonna do that about 15 seconds. And once the 15 seconds are up, then you can dry off. So you dried off your hands, your forearms, you're clean, you don't see nothing soiled. From there, just get a clean paper towel and turn off the warm water. That's how you perform hand washing. All right, so our hands are clean. Let's don on some new gloves, some clean gloves, and let's look at the patient. Okay, so let's see. So I don't have any more gloves, so like I said, I'm gonna just grab some new gloves. I'm gonna look at my patient, look at the wound he has. All right, so if they have any type of dressing, go ahead and remove that. Okay, and with that dirty dressing, just dispose of it. All right, so once you get rid of that, now you got the wound, and you're gonna look at the orders. You know, I always look at the orders again. At least that's what I do. I got my wow, look at the orders again. All right, they want pretty much clean it with normal saline, and then dry it off, and then apply some 4x4s for ABD pad on top. So I got my normal saline. I have my 4x4 container, and let's just say this is my equipment, and this is my 4x4 container. Typically I have two. So I pour my normal saline into that. I have gloves on it, right? And so from there, use one 4x4 and clean from clean to dirty. So you just clean in one direction, dispose of that, get a new 4x4, same thing, going in one direction from clean to dirty. After that, I have another 4x4 pack. This would be my dry 4x4s, and same thing, just go in one direction and then just dry that off. Okay, and like I said, just always look at the orders and see what they have. And like I said, they want us to have a 4x4 or dry dressing on top of the wound. And we're going with a new ABD pad. Okay. And then get some tape, and then just tape it down. Make sure it's nice and secure. Once it's nice and secure, I like to always have a marker, and you put the dates, the time, and then your initials. And then from there, as always, remove your gloves, perform hand washing, and document that you perform wound care and the appearance of the site. Especially if the wound's getting worse or it's looking like there's pus or some type of infection, you can put up a new wound care order in, or just notify the primary care provider or whoever's in charge of the patient's case. But that's mainly it. And then, of course, like I said, just document. And that's it for wound care.